Well, I think our message has been pretty clear from the start, and that is they need to get some proper policies in place. You know, remove some of the contradictions and the policies that don't make sense and that limit us in what we can do as officers here, and let us do the job that we know we can do. But you know, they have to authorize it and allow it. Then we need training, proper training, more training, and it needs to be ongoing. It can't just be hit and miss and sporadic. We need the authority to do the job, and that'll come in the policies and from the state, even if that's how it needs to be. But the hospital has said all along that they can tell us what they want us to do, and that's what they need to do. They need to set some good, clear policies in place, and proper equipment. You know, if they want us to do this job, then any of us give us the ability, give us the proper equipment, and I guess in the end they need to decide what they want us to do. They either want us to do a police job or be security officers. They want us to just be security officers. They have a perfect model up at University of Washington Medical Center where the officers are hands-off. They're not treated like police officers without a gun. And we could just follow that policy and we'd be fine. But so far, that's not what they've chosen to do.
The police officers in the state receive about 720 hours of basic training. We receive almost 100 hours, but yet our injury rate is 12 times the national average of police officers. So that in itself really poses a big question to why we're not getting the same level, if not better, training than law enforcement officers. Security officers believe in what they're doing. They like working here. We love all the staff that we work with. The people really make this job. We like everybody that we work with, and I think that's what keeps a lot of the officers going every day. And in essence, it is a good job. We like working for University of Washington. We just wish they would care about their staff and their public safety officers as much as they care about their patients and everyone else. We just want the University of Washington to do the right thing. I mean, our injury rate in itself should tell anyone, any employer, that there's a significant problem here. Every employer has a responsibility to give their employees the equipment needed to do the job that they're expecting. If there's equipment or tools that can help an employee do the job and do the job safer, then that employer needs to be held responsible and give the employee the equipment they need for the jobs that they're expecting.